the field of psychiatry. Dr. Kersi Chavda is a known name, and we at DocPlus are extremely gratified that he has come here to grace us with his presence. Thank you so much, Dr. Chavda.
Thank you.
To begin with, this might be the most predictable question, but what pulled you in the field of mental health?
Well, when I was a kid, I used to find myself talking to my friends when they had issues, when they had problems with relationships, when they weren't getting along with their parents, when they had academic issues. They would just come and chat, and somehow I used to enjoy talking to them and telling them what I felt they should be doing. And surprisingly, whatever I would suggest, by and large, worked. I was also very, very fond of kids. So when I did my MBBS, at that time I actually thought that I'd get into pediatrics. But by the time I finished my MBBS, mental health kind of attracted me a little more. And I was very, very fortunate in that I also trained under a child psychotherapist. So I got the best of both the worlds. I did children, I did psychiatry, and I haven't regretted it since.
But it is a very daunting profession. It also kind of brings out your own weaknesses and your strengths. Would you like to share some of your insights?
Well, there's no question about the fact that it's a terrible, terrible thing to have a mental illness. And I make money on mental illnesses, but I keep telling people that every morning you should wake up and thank your stars that you don't have it. And you should pray to the good Lord above, saying that whatever happens, don't give me a mental illness. Because what actually happens then is not only do you get affected, but your entire family gets affected as well. It's difficult for you to cope with your own life. It's difficult for your family members to see what's happening to you. And the unfortunate thing is that today just about everybody has some kind of psychological issue. It could be related to an addiction, it could be related to depression, it could be related to severe anxiety. And all of that causes us to react in a way which can be traumatic for us. How do I cope with it? What is my strength? I think basically we work with the premise that mental health is important. And the interventions we do will make a difference to society. And it always, always, always helps when you see somebody who's at the dregs of his life, who just doesn't know what he's doing, who talks of suicide, who talks of severe thoughts which are coming into his head and causing him to find it difficult to function. And then whatever interventions you do, if you're giving medication, you're doing therapy, whatever else is happening, the other techniques that are available now, and you find that it makes a difference to the chap, or you find that it makes a difference to the kid, that's what makes life fulfilling. But there's absolutely no getting away from the fact that it's extremely stressful, because technically what you do and what you don't do, what you say and what you don't say might actually be the fine line between life and death. Because suicide is becoming rampant, and that's one of our biggest fears. It's a tough job, but it has its own compensations, and it makes all the difference in the world when you see a person doing well.
It is, as you just now said, it's a very thin line that you're treading between life and death. At the same time, there's so much that this is one profession wherein the doctor takes 10 steps and the patient too has to take a few steps ahead.
True.
So in a profession like this, there's sometimes, the excruciating factor of the amount of pressure, the amount of the work that you're putting in, the hours that you're putting in. It's tremendous. In that, what was the one experience that was the most excruciating for you?
If you're talking about excruciating experiences, it's probably, for me, would relate to child sexual abuse. There's nothing as horrible as when you have a kid who's talking about how he or she has been molested or treated badly sexually by somebody who, unfortunately, maybe have been part of family. I mean, we've been trained to show unconditioned positive regard even to the perpetrator, because obviously he's also a sick person. But it's very difficult. You have this churning in your own abdomen and you feel like hitting that guy to smithereens, because you just cannot understand how a person can be so incredibly depraved. I think that's probably the most difficult for me to deal with. And I know a lot of my colleagues who don't deal with it because they just can't cope. so they would refer to somebody like me. It's terrible, and especially if you're dealing with 5, 6, 7 of them all at one shot, if it suddenly happens, because unfortunately child sexual abuse is becoming such a rampant thing today, then it becomes very, very traumatic for us. We learn how to detach, but sometimes it's extremely difficult to detach. And then what happens is that unfortunately we'll end up very often also becoming a little cold, a little cynical, and it's tough for us to live too.
That's exactly what I was coming to. When it comes to the kind of life that you've been exposed to, the kind of misery that is around, that you have to kind of cope with, you have to help them cope with. You too are living it, right? Through them, through the way it is. To cope with that is, it's beyond fathom to me. So what is your coping mechanism?
Well, I think over a period of time one learns coping skills. But I do remember initially when I was dealing with kids, or when I was dealing with people who had hallucinations. I started hallucinating. I was wondering whether I was going potty. So we all passed through this. I think my colleagues who become surgeons start wondering whether they have got an appendix which is going to burst. My friends who become gynecologists start wondering whether they've got fibroids because of the pains they experience. It's just a phase that we pass through. But over a period of time, we also get into a stage where we start, to some extent, even though we attempt to be detached, because that's the only way we can survive, an occasional case does get at us. What's also very difficult is, of course, suicide, because the intervention you do or you don't do might actually be the only thing that prevents the person from attempting suicide. And unfortunately, in today's extremely nasty world, there's a lot of legal stuff that we face. So if we do things and it's considered inappropriate by somebody for whatever reason, then you have to face legalities related to that, which adds to the stress. We've got to remember that doctors' relatives also die, doctors' relatives also get depressed, doctors are human beings. Unfortunately, it's not acceptable, and sometimes people take advantage of it. So not only then are we bothered about the right thing to do, we are also bothered about it being legally appropriate, and then we'll end up doing a lot of things which sometimes we wouldn't do, which is unnecessary. It's more bureaucratic rather than actually useful for the patient. Given as it were, it's a tough job, but like I said, every person doesn't do badly, every person is not suicidal. So when you see somebody who's not been doing well, blossoming, coming, smiling at you, complimenting you on what you've done, it makes all the difference in the world. And given what it might be, and the stuff that we see in our papers, I think to a large extent doctors are still fairly respected in our country. They dealt with a fair amount of positivity, and I think it compensates for all the negativity that we have to face.
Would you be able to share a case perhaps wherein you've completely changed the strategy for your patient, for your if you could just share some of the insight on a particular case perhaps?
Okay, so there are lots and lots of cases like that, because after all I've been in this field since more than 30 years. But there's some things that really get at you. I remember there was this girl who had just broken up, young girl who had just broken up with her boyfriend, and she felt that there was no point in living. And she actually got into this thing of the only reason why I didn't get along with the guy, why he wanted to break up with me, and why I accepted that is because he wanted me to have a sexual relationship, which I was not willing to do. And then she started wondering whether there was something wrong with her. She started wondering whether that sex was the only thing that mattered, and so on and so forth. There was very evident, it was also very evident that she did have a depressive element in her, and that she had something where her personality was such that she started feeling very inadequate about herself. Started wondering whether she was a good person, whether anybody would like her, and so on. I think a combination of medication and therapy that we did on her made her change her viewpoint of herself. Just out of the blue, if I ask you, say 5 bad things about yourself, most of us won't have a problem with that. I talk too much, I snore too much, I don't look good enough, I'm not intelligent, blah, blah, blah. And then if I ask you, tell me 5 good things about yourself, people have to think. We're so used to seeing negativity in ourselves and in everybody else We're so used to flagellating ourselves because we set impossibly high standards for ourselves and for the people around us that it becomes an issue. So I think what we need to do is change our orientation and be nice to ourselves. And like I keep telling everybody, and this worked with this person, treat yourself like you are your own best friend. If your own best friend came to you and said, I have this, what would you do? You wouldn't say you're an ass, you're terrible. You'd say it's okay, move on with life. We all make mistakes. And when you start looking at yourself like that, and when you metaphorically and physically touch yourself on the back and say you're a good chap, somehow things change in the brain also. And you start becoming more accepting of yourself.
You, in the course of this case that you were sharing with us, you just mentioned the medication factor that has helped sometimes and stuff like that.
Yeah, let me talk about medication. There's an enormous amount of myths about medication. I mean, and with Dr. Google being in the picture, it's becoming even worse. We must remember that Dr. Google is just about 12 years old and we've been here since much, much longer. Today, the trend is moving towards biological psychiatry. So we do think in terms of neurotransmitters, we do think in terms of certain areas in the brain which get affected. We do think in terms of the side effects associated with whatever is happening in your brain system. So it's becoming extremely biological. A lot of us believe that this interface between neurology and psychiatry is actually just for the sake of it, because we're both of us dealing with the brain. And both of us very often, I mean the neurologist and I, would very often collaborate when we are dealing with problems associated with the mind. When we talk of medicines, it works in a variety of ways. You have specific medicines which release neurotransmitters which make you feel more positive. You have specific medicines which make you feel less anxious. There are medicines which work on issues related to obsessive thought. Maybe many, many years ago, the medicines we had caused a lot of problems, a lot of side effects. But today's new medicines work specifically on specific receptors on certain parts of the brain, etc., so that the kind of side effects you see are much, much less than what they used to be. Now, this whole myth of how long do we take medication, is it going to cause side effects? Nobody ever asked that of a thyroid specialist if a thyroid is malfunctioning. If you have high blood pressure, you're not going to ask the cardiologist, can't I stop the medicine in 3 weeks? No. If you have diabetes and you've tried the other methods and it doesn't work and you're given medicines, you're going to probably take it for the rest of your life. Somehow those things are okay. But if we suggest that medication for psychiatric illnesses should be given, it becomes a big bugbear. How can we do that? I will become a zombie. I won't be able to study. I won't be able to concentrate. People will think I'm mad. This is the kind of nonsense that I hear, which is terrible. A lot of people say, can't I cope without medication? And I say, if you're looking at quality of life, and if one small pill makes all the difference between living a good life and living an okay life, then I think it's dumb for us not to take that one small pill. Especially when we know that, by and large, given appropriate medication in appropriate doses is not going to cause too much of a problem in terms of side effects. It is dumb for us not to take them. The other thing that we should also remember is, can I cope without medication? I probably cope without my spectacles. But the quality of my life would be so much inferior. Maybe you'd cope without your medication if you're anxious or depressed or whatever, but you'd lie in bed, you'd look up at the ceiling, you'll feel anxious, you won't want to go out, you'll have paranoid thoughts, you think people are looking at you, you wake up saying, he's after me, she's after me. Is that the life you want to live? No. And if 1 or 2 medicines that you take make all the difference and you can live a normal life, it helps your family members, it helps your kids, it helps you, it helps your colleagues at work, then I think it's ridiculous for us to get into this medicines are bad thing. And by and large, most people who talk about medicines are bad have no idea about medicines. They've read about it somewhere, or somebody has told them that it's bad. And I get into this thing of, kisne bola, who's told you? Usne bola. Who's the he? Is he a doctor? No. But he knows. How does he know? He's heard. Who's he heard from? Somebody else. It just goes on and on and on. Absolutely irrational behavior. And half the time we are just telling our patients it's okay to take medication.
When you just like a lot of things that came up, one of the questions that I want to ask is that when you're dealing with patients who are already not thinking in perhaps a normal course, and they have kind of experienced maybe misdiagnosis, perhaps the same kind that you've mentioned, people have not really given them the right direction to go to, and at the same time given their mental health, it's very difficult to convince them then. What is your modus operandi that time? How do you...
Now it all depends on the individual case as well. It all depends on the individual diagnosis. You have the comparatively minor ones like your depression, anxiety and things like that. And you have the more major ones like schizophrenia where you believe everybody is wrong and you are right. At least the person who's depressed will believe that, yes, I have a problem. The person who's schizophrenic will say, I don't have the problem, you have the problem, you need the medication. There are different techniques of dealing with it. There are different ways of communicating with people. Very often we use the help of the family members in persuading them to take medication or whatever else. And in extreme cases, if the person is absolutely out of control, very aggressive, or at danger of harming either himself or somebody else, then there is something called involuntary admission, where a family member would sign in and say that he's a danger for himself or he's dangerous to somebody else. He's beating up my mum and dad, he's breaking things in the house, he's threatening to kill us, he's running around with a lighted flame. We feel that he's at danger and he's mentally not okay. At such a time, you can admit a person against his will. But of course, there are a lot of safeguards in that. So the magistrate comes around, checks out, and then he's treated. Evaluation is done in the center in which he's admitted, and then proper treatment is given to him. So there's a whole gamut of steps that can be taken in order to get help to a person who needs help. People who come to us voluntarily, much easier to treat, obviously, because they believe that there is a problem, or at least they believe that they're willing to check out and see if there is a problem. People who don't come to us, much more difficult.
What has been the most satisfying part of this profession for you?
I think the most satisfying part of this profession probably has been to see happiness on a person's face when he gets okay, or to see acceptance by a family member when she feels or he feels more competent and more capable of dealing with the psychological issue. I mean, visualize a mother who's come to me because she's just delivered and she's found that the child has mental retardation. Nobody gets child thinking that there's going to be something wrong with the kid. Nobody gets married thinking there's going to be a divorce. And it's incredibly traumatic to that person to be told, your child has this issue. Very often mothers, especially mothers, become very depressed, they become suicidal, they talk of killing themselves and so on and so forth. If we can somehow support them through that time period, work through also the reactions of the family, because over here family support is essential. Work through the spouse, because obviously daddy also gets affected. Occasionally give medication, support and help the parents through it. Enable the parents to see the joy of having a child, even if there are differences in it. I think that's one of the sweetest things that you can ever see. You also have people who are severely psychotic, out of touch with reality, and you give them the medication and do whatever else has to be done, and you find them coming back to normal, living good lives, managing to function in a job, getting even in a relationship with a person who accepts that there might be some foibles, but it's okay, living productive lives. That's probably one of the best things that we can see.
When there are cases that that don't go as positively as, it takes all kinds.
Sure.
How do you cope with that? Because I'm sure that affects
that.
You
Of course,
too.
it affects us. We don't like the thought that what we are doing with our patients is not working. In my situation, very often I would ask for a second opinion. So I would send to a colleague of mine, and we'll get a fresh perspective on what is happening, and then we'll collaborate and work together. I think that's the only way that we can also make it, because obviously we're not omnipotent. Obviously at times we might make mistakes or might miss out on something, or just get a different perspective on the same situation and see if something else works. I think that's the way it works. Does it affect us? Of course it does. Does it make us feel that we are, When do we start feeling that we are incompetent? Of course we will. It's a phase we all pass through, because I don't think anybody can ever be always right and always successful in the treatment that he's giving to a child. But by and large, if I'd say 70 to 80% of what you're doing seems to work, then you're on a very good wicket.
As I mentioned, in a profession as daunting as this, when it's not always that's going to be a perfect success and things like that, and inadvertently you take it home somehow.
Sure.
How do you cope with that, and how does your family cope with that also?
Well, it's tough at times. It's very tough when you're dealing with a kid who has, say, cancer at the age of 3 and 4. It's very tough when you're dealing with a lady who's been beaten up by her husband for no apparent reason. It's tough when you see a family which is absolutely shattered because one of the family is either alcoholic or is on drugs or stuff like that. It's very tough. We grow with the premise that good will prevail. We grow with the premise that justice for all and all that stuff. And sometimes you think it's not happening. You look at, you wonder what is just in having a little 3 or 4 year old child having a severe tumor in the brain. What is just in that? And so on. However much we are detached and however much we try to be clinical about the whole thing, of course we have emotions. It's tough at times. You're dealing with a kid who's dying and you come back home and your son is sulking because he hasn't got the latest pair of jeans, and you say, what the hell is happening? How can we balance life like this? I work out a lot, so it helps me tremendously. When I want to give galis to a patient who's misbehaving and I can't do that because it's not therapeutic, then I
to say the least,
then I kind of work out a little heavier and I give galis to the weights as I lift them. It helps a lot. But there's no getting away from the fact that at times we do become very quiet, very withdrawn, and my family wonders what's happening. But I've been married since a fair amount of years, so my wife kind of figures out that if it's a bad case, she kind of lets me be and then gently talks to me, and we try to figure out how I can cope with whatever is happening. What also helps is a very good friend circle. I'm blessed that I have a lot of friends. I'm blessed that we can talk and talk absolute nonsense, because that's probably the safety valve that keeps us sane. You have to remember that some research was done in the number of professionals, the kind of professionals who get most affected by their work, so much so that they become either depressed or suicidal. And guess who tops the list? The psychiatrist. Guess who's at the bottom of the list? Politicians.
Ouch. In a country like ours, which is so diverse when it comes to socio-economical diversities, I'm sure that I think Indian doctors experience the most diverse kind of patients coming to them. It's a whole gamut. What is how do you cope with it? Because there's so much.
Yeah, there's so much of diversity. I quite agree. We've got so many religions, so many cultures, so many diverse ways of looking at things, it becomes a little difficult. I think it's easier in the bigger metros. In the smaller places, because sometimes we have camps in smaller places, you're a little startled at what you do see. I remember that I was in another state. We had a psychiatric camp kind of thing. And we had this girl who was brought in on the second day by her brother-in-law or by her brother, I can't remember who, on a stretcher. She had what we would call an acute psychotic episode. She was talking a little irrelevantly, blah, blah, blah. And being in a place just about 40 or 50 kilometers away from the main city in that state, I'm not going to mention which state, she was taken to a local guy who branded her and said that you're a witch and the witch part is going to be removed from you, etc., etc. Fortunately, the brother-in-law was there, heard that, a psychiatrist from Bombay is coming to this place, and against a lot of opposition, brought her to me, put her on a stretcher, brought her in a train, fantastic stuff. I suggested she should be admitted for a day or two, and we very often see what we call drug-naive people who've never had medication, very often respond fantastically. We gave her some medication, and in 2 days, in a sense, she was fine. Okay, she would need medication for a much, much longer time period, but she had come back to so-called normalcy. The hassle then was, she had to stay in that hospital for about 3 weeks, because what had been branded on her had become infected. So she had to get a treatment for that. And we are talking of a place 20 kilometers from a huge tourist center in one of our states. It's frightening what happens. Saying that, I'd certainly say that there's a lot of change over the last 15, 20 years. More and more people are talking about it, more and more magazines coming out, more and more talk shows, film stars coming out and saying, I've been depressed, I've got bipolar. It makes a tremendous amount of difference. People are talking so much more about it. It's also making a difference in our medical colleges. At one time, not too many people wanted to take up psychiatry. Today, the toppers want to take up psychiatry, and I think that's a fantastic movement ahead. A lot of our boards, the CBSE, ICSE, even the SSC, is propagating the use of counselors in schools. So they're talking of mental health.
Right.
Our newspapers are full of mental health. So I think there's a lot of change. I think it's positive and it's fun. It's tiring, it's stressful, but it's fun.
When we started off, there was, I'm sure when you must have started off in your profession too, people accepting that they have a problem was perhaps far less as it is today. At the same time, there is this whole section of society, even in Bombay, who thinks it is cool to go to a shrink, as they say. This entire diversity, at the same time, to explain that, some people really need attention and some people just need attention. So to balance that, how difficult is it? And
well, it's not very difficult. I'm never going to tell a person who comes to me that you shouldn't have come to me, because a lot of people come to me now, like you say quite correctly, because they don't feel there's something wrong with them, but they feel they'd like to actualize their potential. They'd like to do better than what they're doing. And you find that in a lot of big industrial places where you have top shot head honchos coming to me and talking about their problems in terms of occasional communication, in terms of dealing with their colleagues, in terms of their own irritability, their own feeling that they should have been a 50,000 crore company, they're only a 45,000 crore company, what do I do? That kind of thing. And we also do have that section, like you say quite correctly, even in our metros, which says that I don't have a problem, why should I go to a shrink? Well, all sorts make the world. And over a period of time, we do realize that, there is a limit to what we can do. We give advice, eventually the person is actually going to do whatever he wants to do. At one time, we would bang our head on the wall and say, why are you doing this? Can't you make out that it will make a difference to your life, etc., etc.? Today we accept. We become more accepting, we become older, we become more understanding of the fact that different people have different viewpoints, and a different point of view is not necessarily a wrong one. Wow. What gets at us is allopathy is bad, everything else is good. That's nonsense. And there are so many times where you feel like killing somebody, where a person who's been absolutely well maintained on allopathic medication meets somebody who says, oh, you can't take this medication, come, I'll give you homeopathy, I'll give you Ayurveda, I'll do Reiki on you, I'll give you wheatgrass therapy, blah, blah, blah. And then he comes back in a terrible state of mind. I think people should butt out when they don't know enough.
You've been very closely associated with the Indian Psychiatric Association. What do you suggest? How can it improve? How can it improve the state of life in India too?
Okay, now I've been associated with, I was the president of the Bombay Psychiatric Society, and I've been associated with some of the task forces of the Indian Psychiatric Society. It's certainly not up to me to tell them what they can do to improve it, but I would say that a lot of work is happening. We are divided into zones. India is divided into zones, and every zone is doing an enormous amount of psychiatric work. If you actually wanted to attend a seminar or a continuing medical education program or something else in mental health, you could attend it maybe 2 or 3 in a week. It's like that across the country. There's an upsurge of stuff that's happening. More and more people are doing stuff, which is why it's coming out into the limelight so much. And the government is attempting to do things also. Sometimes the government listens to us, sometimes it doesn't, which is a sad thing, because certainly bureaucracy is not what they should be listening at. Unless you actually have a psychiatrist at a panel, it's very difficult for you to deal with laws which reflect what is happening in the Mental Health Act. So we fight, they support us, sometimes they don't. We like them, sometimes we don't. Life goes on.
Putting it really subtly. When it comes to India's mental health, what's your vision for us?
I think India has tremendous potential. Just like we had this huge surge where we were not connected digitally or with telecommunications, and today we are one of the best in the world probably in terms of telecommunications. I think we have an enormous amount of stuff that we can do in India just because of our population. The amount of experience we get, the number of patients we see, because we are comparatively a very small group of professionals in psychiatry, is enormous. So the experience that we get is more than the experience anybody anywhere else in the world can get. I mean, they talk of a heavy OPD with 8 or 9 patients in a day. We talk of a heavy OPD with 50 and 60 patients in a day. That's the kind of thing, at least. When I look into the future, I think there's a lot that can happen. I think it's not necessary for us to have this interface between neurology and psychiatry. I believe that there's going to be a lot of collaboration, much more than what is happening today. Just like we talk of augmentation of a lot of things, I think the brain is the final frontier. So we're probably going to be able to do things where we're going to be able to augment certain, say, cognitive abilities in the brain, augment concentration in the brain, maybe make us more intelligent. I'm sure we are already working on things so that specific medicines work on specific things, and you'll be able somehow to know before you give a medicine to a person whether it's going to work or not. It's an incredibly exciting phase of our lives, and I would have the hope that from being Homo erectus we become Homo superioris. And I think psychiatry will be at the forefront of that.
For sure. I mean, that should be the vision, because the way the world is going, especially the children, they're so badly affected with so many things that are coming up. What is your take on the millennial child?
On the millennial child, I think we are doing a horrible injustice to our kids because, at least in India, because of the pressures that we are putting on them. When I was a medical student, we would say the commonest age of suicide would be late adolescent, 18, 19, 20. Today we are seeing suicide at 8, 9 and 10. We would talk about learning disabilities, autistic features and things like that in a certain percentage. Today the percentage has grown crazily. I mean, when I was a medical student, I think we were told 1 in 10,000 for autism or 1 in 1,000 for autism. Today it's 1 in about 70. So there's something crazy happening, possibly in our environment, possibly in the way we're dealing with things, possibly in the food we eat. There's something that's going wrong. I believe also that there is a lot happening in the field of child. There are activists, there are people doing things. We are providing concessions in terms of learning disabilities. Schools are getting a little more sensitized than what they used to be. Though of course we are hearing these horrible tales of what happens in schools as well. I'm optimistic. I don't think I can survive if I'm pessimistic in this world. So I'm always optimistic, always hoping that something more, something better, something good will happen. And that somehow India, when it takes its rightful place in the world as a powerful country, will also be powerful in the field of mental health. I think we all have to strive towards that, because no country can be only physically powerful and have a great army and eat a lot of food. We have to be mentally strong as well for us to be considered to be a superpower.
Let's talk a little bit about problems wherein coexisting mental illnesses, like when there are multiple problems and stuff like that. Dealing with it, I'm sure, will be far more difficult. What has been one of the most difficult challenges that you've had to face?
Well, I think probably the most difficult challenge is that sometimes we want help from other professionals as well. So we work in a multidisciplinary thing. So maybe I have a person who's anxious, who has anxiety disorder, and in addition to that also has epilepsy. So I might want a neurologist to have a look at it. Maybe because of whatever is happening, he's not able to use his hands as effectively as before. He's a little restless and things like that. I might get in a physiotherapist and an occupational therapist, and so on and so forth. A multidisciplinary thing, of course, becomes more expensive, and it's difficult for people to coordinate also between all the disciplines, and that becomes tough for the person. I mean, we must realize that we just give a suggestion that you should do this, you should do that, but the person who has to do it maybe also has his other life to live. He has a spouse, he has other kids, he has money issues, he has his own parents who have their own issues. So sometimes the kind of concentrated effort that you want for him to give to the affected patient is not as much as it should be, given the constraints that he's facing. Because of that, responses may not be as good as they would have been if there was more concerted effort. Like I said, we support to the best, and finally, eventually, the person does what he has to.
What would you have to say to the young doctors who are perhaps aspiring to be?
I'd say it's a tough job. I'd say if you're talking of doctors who are aspiring to be psychiatrists, I would certainly say there's a lot that they have to do. There's a lot that they will learn, and there's an enormous amount of change that is happening every single, year. So they'll have to keep up with whatever is happening. I would believe that they need to have more than just clinical skills. They need to be gentle, they need to be accepting, they need to be good on a bedside manner kind of thing. Because this is probably the one field where if a person is not comfortable with the doctor, it's going to be very difficult for him to follow and do whatever the doctor says, even if the doctor is a fantastic clinician and knows what he's talking about. So it's wonderful if you're a fantastic clinician, if you're very intelligent, if you do brilliantly, if your diagnostics are great. I would think it's equally important for you to be a nice person and to come across as being empathic and kind and gentle when it's needed, and to be firm when you have to as well. So that's my advice to the youngsters of today. Come in with open eyes, attempt to change the world, because we all did that when we were your age. Be sensible about what you're doing. Unfortunately, today things have become very, very legal, so be very legally careful with what you're doing. Document everything. And hope that what you do will make a difference to the world, because it certainly will.